Depression in teens. It is not unusual for young people to experience the blues or feel down in the dumps. Adolescence is always an unsettling time, with the many physical, emotional, psychological, and social changes that accompany this stage of life. Unrealistic academic, social, or family expectations can create a strong sense of rejection and can lead to deep disappointment. When things go wrong at school or at home, teens often overreact. Many young people feel that life is not fair or that things never go their way. They feel stressed out and confused. To make matters worse, teens are bombarded by conflicting messages from parents, friends, and society. Today's teens see more of what life has to offer, both good and bad, on television, at school, in magazines, and on the internet. They are also forced to learn about the threat of AIDS, even if they are not sexually active or using drugs. Teens need adult guidance more than ever to understand all the emotional and physical changes they are experiencing. When teens' moods disrupt their ability to function on a day-to-day basis, it may indicate a serious emotional or mental disorder that needs attention. Adolescence depression. Parents and caregivers must take action. Dealing with adolescent pressures. When teens feel down, there are ways they can cope with these feelings to avoid serious depression. All of these suggestions help develop a sense of acceptance and belonging that is so important to adolescents. First, try to make new friends. Healthy relationships with peers are central to teens' self-esteem and provide an important social outlet. Number 2, participate in sports, a job, school activities, or hobbies. Staying busy helps teens focus on positive activities rather than negative feelings or behaviors. Third, join organizations that offer programs for young people. Special programs geared to the needs of adolescents help develop additional interests. And number 4, ask a trusted adult for help. When problems are too much to handle alone, teens should not be afraid to ask for help. But sometimes, despite everyone's best efforts, teens become depressed. Many factors can contribute to depression. Studies show that some depressed people have too much or too little of a certain type brain chemicals. Also, a family history of depression may increase the risk for developing depression. Other factors that can contribute to depression are difficult life events, side effects from some medications, and negative thought patterns. Recognizing adolescent depression. Adolescent depression is increasing at an alarming rate. Recent studies indicate that as many as 1 in 5 teens suffers from clinical depression. This is a serious problem that calls for prompt, appropriate treatment. Depression can take several forms, including bipolar disorder, which is a condition that alternates between periods of euphoria and depression. Depression can be difficult to diagnose